two things play an extremely important role in terms of the predictive value that you're going to have a secondary procedure. Now, number one is what kind of procedure you're having. So farsighted patients, people who are farsighted, are having a slightly different treatment than nearsighted patients. We're trying to make the cornea steeper to allow them to have magnification. And with that magnifying treatment, there's a trench being created around the rim of your eye. And that trench wants to fill in with the skin surface of your cornea, which can cause regression. So in my practice, I tend to slightly overcorrect you, allowing for this small regression. It's a couple clicks on that machine that will occur after the surgery. And so our retreatment rate tends to be well under 1%, even for that population. Patients with really large prescription powers, we don't really want to overcorrect them. We'd rather undercorrect them. So in a patient like that, you do not want to be farsighted. So we'll, if anything, leave you a little undercorrected, with the idea being that you're likely 20 happy. And if you're not, we can come back and provide a retreatment at a later date. In general, with modern technique using laser flap makers or PRK and modern lasers, the retreatment rate for virtually all centers has dropped below 1%. And if centers are claiming rates higher than that, then perhaps their technique or their evaluative process is not as extensive as it should be. We can identify corneas that are not ready for LASIK. So if you've been wearing contact lenses extensively, sleeping in them, if you've been wearing a toric type contact lens, we may want you to wait 4 to 6 weeks or even longer to allow your cornea to restore back its normal shape before proceeding to the procedure. So it's very important you understand that when we ask you to get out of those contacts, this is your number one way that you're not going to have to come back for a retreatment. So if you have some questions about this, call my clinic, 630-724-1400, or go to our extremely informative website, www.glassesfree.com. And remember, there's no charge for your initial consultation.